There's a story that my family tells that I actually watched a PBS special on the brain when I was very young with my dad, and that sort of triggered it. And I don't know if it just stayed with me. And when I went to medical school, it was fascinating. It made sense. You know, the brain, the highways, the connections, and you could track things back. But then simultaneously, we didn't know that much about it. So there was still room for intrigue, still room for creativity, and still room for research. And as a woman, it was a little bit more of a bigger decision. So I just explored every aspect of it and said, if I come home every day and I'm happy and I'm smiling with what it is that I'm doing, then I'm going to go for it. Some of the more frequent things that we would see in neurosurgery would be disc herniations in the neck and in the low back. And we can do those, you know, from minimally invasive types approaches as well, where we remove a small portion of the disc. We do those routinely at South Shore Hospital. Some of the more complex things that would come in would be maybe a tumor that would be at sort of what we call the skull base. So that's the bottom of the skull. And really important structures will leave the bottom of the skull. And there are special bone removal techniques that you might use in order to access those tumors and to be able to remove them without causing any neurologic damage. And there's a lot of things that can be done in the community hospital setting, and the great thing about creating this new department here is that we have access to the tertiary center and all of the academic medicine and research that is readily available there. Neurosurgery is it's a scary topic for a lot of people. So to try to break it down and explain this is what's happening, and then explain these are the different types of treatment approaches that we can take, and the pros and cons, and why you would do these things. And that allows patients to actually be truly informed within their own care and make an informed decision for themselves.